Hello and welcome to the Puzzle of Us podcast. I'm your host, Chelsea Peterson, the owner of Cache Valley Counseling, and I'm excited today to share my over 15, almost 20 years of experience with working with various people with you today, particularly about fears. We're going to be focusing on facing your fears and the difference between phobias and fears, and we're going to break that down and talk about what do you do and what do those look like. I want to first focus on the difference between a phobia and a fear. So a phobia is a little bit different. A lot of common lingo that I hear people say is, oh, I have a phobia of that. And again, there is a significant amount of people who will deal with a phobia at some point in their life. I think the research is that like 12.5% of all US, so that's not global, but just US adults will at some point deal with some sort of phobia in their life. So phobia is a type of anxiety, and it's a fear-based response. So what does that mean? What is a phobia versus a fear, right? A fear is your body's response or a natural response to something that happens, right? Like to an animal or to a situation or to the dark or to things like that. That's a natural response. Like you should feel fear. We want people to feel fear. Fear usually protects you, keeps you safe, does all those good things. So fear is a good thing, but sometimes fear can turn into phobias. So for example, someone might have a fear of flying, but at times they may be able to overcome the anxiety or push themselves to kind of get on a plane. If someone has aerophobia, which is fear of the air, right, they may never fly. They may have to be sedated, like all those sort of things, right? Like they get so much to a panic attack moment that they're unable to even step foot on the plane. And again, it can be to the plane specifically, it can be to the air. There's lots of reasons and lots of different things that it can be triggered by. So some common phobias that I often hear people kind of talking about is arachnophobia, which is fear of spiders, which again, I can be fearful of spiders, but if I have a phobia of spiders, it's essentially kind of dictating whether or not I avoid places or I go places or things like that. So again, the daily function of life, I cannot like spiders, and it's a preference of me not to be around spiders, and I don't particularly want to, ever own a tarantula or something in my house, but it doesn't mean that I'm necessarily afraid of spiders. Or I could be afraid of spiders and not have a phobia. So there's also acrophobia, which is a fear of heights. So a lot of times people, will not go on roller coasters or things like that, right? Like I might not particularly like heights, but I'm willing to do it, right? Claustrophobia. So a very common one is when people feel closed in on. I even see that when people come and sit right back there on that couch. If people can't, there's this a reason why this room is set up the way that it is, because oftentimes people feel claustrophobic when they when they can't see their escape, or they can't see, there's the door, things like that. So oftentimes, therapy rooms, doctor's offices, things like that will be set up in a way that, the door is easily accessible or can be seen straight on by patients or clients. If you feel uncomfortable that way, it doesn't necessarily mean you're claustrophobic, but that definitely can be a way that you're seeing claustrophobia sort of play out in everyday life. Feeling uncomfortable, again, of confined spaces. Again, oftentimes phobias, we don't start out as phobia, we have a fear of it, or we don't particularly like it. And then typically things turn into phobias when something traumatic happens in our life, when we have an experience that isn't quite comfortable. So for example, I've had a client in the past who was incredibly claustrophobic and never really felt comfortable with tight spaces, but they had the unfortunate experience of teenage kids playing around, and they made her get in the back of the trunk, and then they thought it would be funny to leave her there for a while and then drive around. Again, they were there, they were present, they didn't ever leave her, but it's a traumatic experience for her. And now anytime she feels like I'm in a tight space, she tends to start freaking out a little bit. She tends to start panicking to the point of having a panic attack and not being able to think about, going in a straw maze or a corn maze or things like that. Like oftentimes people get that sense of like claustrophobia. Like I don't know where I am. I don't know where my exit is. I feel everything tight and closing in on me. So again, that claustrophobic is that confined space sort of feeling. Social phobia is a very common one, unfortunately, that I feel like many people didn't maybe used to struggle with as much, but due to online accessibility and people working online and essentially being able to have a whole life that is online where they're not physically interacting with people, even to the point of like I can pick up my groceries without even really talking to anybody. And so a lot of our world has become easier, yes, but for some of those like social phobias that happen, it's actually become maybe convenient for them, but they're also not stretched to get over those phobias. So then they also tend to become worse. And then another common one is agoraphobia, which is a fear of open or public spaces. So again, those are the kind of the most common that we see across the board. Causes of phobias. There's a lot of things that kind of factor in and play into why phobias even become phobias and don't just stay as fear. There is genetic predisposition. There's environmental factors, like I mentioned, traumatic experience, situationally, like what has happened in your life that you've experienced that play into these phobias. Learned behaviors from parents or peers, and sometimes brain chemistry and the fear response. So there are several people in my in-law families they do not like mice. They are very, very afraid of mice. They don't like mice, but they don't necessarily have a phobia. And they talk about it as, when they're talking about it in everyday life, or they're like, oh yeah, I saw a mouse, and this is what my response was, like, oh, I have a phobia, I have a mouse phobia. Yes, they do, and they don't like it, and their response is such of like, they've been known to like stand on top of a counter and to like get away from the little mouse running across the floor and things like that. And again, in the moment talking about it now, it's kind of, it can be funny. But in the moment, that fear response is such that they can't think past that and function, but that's a fear, right? Like that's in response to there is a mouse. A phobia might be, I saw a mouse there, the potential of a mouse being there is such that like, I'm not even gonna go in my bedroom. I'm not even going to walk into the kitchen. I'm not even gonna live in my house anymore because the fear of a mouse. I can't go outside. I can't, like, phobias impede life functioning. And so yes, they are afraid of mice. They don't necessarily love mice. Are they ever going to get pet mice? Absolutely not. But they're not necessarily a phobia. So again, there's lots of reasons that these various things happen, they can be learned responses, right? If this is how I was taught to respond to mice, or to, any of these other life experiences, I could mirror what I have seen play out in my own family or in my own, life experiences. So when that happens, oftentimes we respond that way, the way that we were taught to respond, or the way that we saw other people respond, or the way we feel like is socially acceptable to respond. But that doesn't necessarily mean that because we have that response, we have a phobia. So again, it's a little trickier to really like nail down, what's a fear and what's a phobia. But I would really ask yourself the question of like, does this impede my life, my daily life functioning? And phobias usually, creep up because it's a random Tuesday, not just like, oh, well, I don't think I'll go outside today because there might be a mouse, or whatever it might be. So some things that can be really helpful when you're talking about a phobia specifically, it is very, very unlikely that someone will be able to overcome that phobia without specific like therapeutic treatments. There's some really cool stuff coming out with different treatments like ketamine treatments and things like that can be really helpful in helping the fear response stay at a lower rate to be able to process through some of these specifics. But again, if it's not a phobia that's impacting your daily life and the functioning of your daily life, it may not be something that you ever really seek therapy for. But usually it's not going to be overcome without some professional therapeutic help. Really common practices when managing phobias are some CBT stuff, and CBT, for those of you who aren't familiar with that, is a type of therapy. It's a cognitive behavioral therapy, and it can help you identify negative thought patterns of this fear is irrational, and here's why it's irrational, and here's why I would be safe, right? If someone has a fear of flying, I'm not going to get on a plane. You might use CBT to say, how many flights take off a day, how many flights are safe, how many passengers on average are flying in the United States per day, and how many of them are safe, right? You might use that to say, okay, this is an irrational thought that needs to be managed or controlled or challenged in some way, and you would use logic to help reason through that. Another very common one, particularly with phobias, is desensitization techniques. So you are gradually exposed to the fear that you are afraid of, and it helps you to then control the whole process is let's say, I'll give you an example. It's kind of easier if I give an example. So an example would be, let's say I have a social fear, and we start with desensitization by we're just driving to the parking lot of a busy, mall or something, but I'm not going in, I'm not doing that. So I do that the first time. Then the next time I drive there and I walk up to the door, but I don't necessarily go in. I don't talk to anybody, I don't go in, I don't socialize with anybody. But I do that. Then the next time I go in and I walk into a store. And then the next time I go, with the goal of talking to one person. And so again, you can kind of see that over time, it's this desensitization as to the fear, right? A social phobia or a fear of flying. I'm going to go spend time in the airport. I'm going to go watch planes fly. I'm going to watch videos of planes flying. I'm going to be in a simulator. Whatever it is that there's a slow process in which you go through to desensitize yourself to the fear or the phobia that you are experiencing. You can do this on your own if you want to. Again, there are some things that can go wrong. So just to be watchful of those is, if you push yourself too hard, you can elicit panic attacks. You can make things worse. You can make the fear worse. And so making sure that you go through proper channels. Again, professional help is the best way to do this. Desensitizations do work, but there are also other routes that may not need to completely expose you to the actual fear that can help as well. Another thing that can be really challenging with the desensitization is this fear response. If you desensitize yourself so much that your fear response essentially no longer works, what happens when your fear response needs to kick online and it doesn't? There's a lot of argument for one versus another. I don't necessarily think people are going to completely shut down their fear response because humans and we keep thinking logically and we keep going through these processes, and it's fine. I don't think we're going to ever completely shut that response system off. But there can be things that there are some arguments out there that people learn to control that fear response, and then they end up getting themselves into trouble because their fear response didn't keep them safe. So that is just something to think about if you're interested in the desensitization process with phobias. So the third thing that can be really helpful is one of my favorites. My particular favorite is mindfulness and relaxation techniques. And again, a lot of those can be, I picture a spider in my mind, and I'm able to learn to control and manage and think I'm okay. I'm able to sort of mix all of this desensitization and CBT kind of in together of like, I'm okay, I'm safe, there's not really a spider, and I'm able to feel what that feels like, push myself in that discomfort, and also find comfort pretty easily. And again, that those are also things, breathing techniques, relaxation techniques, things that we've talked about, I feel like ad nauseum on my podcast, of just being able to breathe and calm yourself and be able to recognize, like, how am I feeling? And this doesn't feel comfortable for me, and how do I do it different? And what do I need to feel safe? And if we can help you find safety, particularly whether it's in a breathing exercise or a relaxation technique, it's much safer than just completely, desensitizing you to fears. Sometimes in the moment, it's really hard to come up with those positive, statements or stop those negative thought patterns. And so if you can do those in a way that feels a little bit more in control, people tend to have a little bit better result. Again, fears and phobias. Could everybody have a phobia? Sure. Ask yourself the question, does it really impede my daily function? If it does, and maybe it does for a period of time, but then it goes away, is it a phobia or a fear? Those are, again, kind of just some questions to ask yourself as to which one it might be for you. Either one isn't fun, and it's not fun to feel the fear. But again, the treatment of that might be a little bit different if it's just a fear versus a phobia. Yeah, phobias can be really hard, and I think there's a lot of phobias, particularly around the holiday season of Halloween, of people's discomfort come out, right? Like creepy crawly things, dark, scary, those sort of things. Halloween can be really, really quite a delightful Halloween or a holiday for a lot of people, but it can also be really scary because a lot of people's kind of phobias or fears that are put away or not dealt with for the majority of the year kind of come out at this time of year. And so Halloween can be kind of creepy for some people, but for a lot of people, they love it. If you do find yourself struggling with a phobia, if you've asked yourself this question of like, yeah, it does really kind of get in the way sometimes, I would really, really encourage you to seek professional help. It is not fun to live with, and there is help out there, and you shouldn't have to deal with this or try to manage it on your own. There's a lot of things out there that can really help you feel better about life. And so I would highly encourage you to seek help if you find yourself having some phobias. Again, thank you for listening to my podcast and ramble on about fears and phobias, and just address some of those, and kind of really ask yourself, am I fearful of things, and am I fearful, and why am I fearful of them, and are they bordering on phobias? Do I never go on roller coasters, and do I not live out that life or enjoy that time because maybe I'm afraid of heights? Or I don't ever put up Christmas lights because I'm afraid of heights, or things like that. Again, it may limit your life at some point, but it doesn't, is your quality of life lessened because I don't put up Christmas lights or I don't go on a roller coaster? Again, that's where phobias kind of come into play there and make it not very fun to live. So thank you for listening to the podcast, and as always, check us out on all of the socials and follow us for more tips and information and more podcasts to come. Thanks for listening. I'm your host, Chelsea Peterson. We'll see you next time.